consider than just the pill. Hi, I'm Beth DeVries. I'm a nurse practitioner specializing in gynecology at Mid-Michigan's Center for Women's Health. Let's talk about options for preventing pregnancy. Today we have many different methods of birth control to choose from. Each has its pros and cons. Some are more effective than others. There are many types of birth control: reversible, non-reversible, long-acting, short-acting, hormonal, and non-hormonal. Longer-acting methods of birth control are more reliable at preventing pregnancy because they don't depend on you to take action. All of us will at times forget to take a pill at the right time of day, and many people find it is not convenient to use a barrier method during sex. On the other hand, long-acting devices are generally more invasive and require a procedure, whereas less invasive methods may be more readily available with or without a prescription. Keep in mind that the most effective forms of birth control don't protect you against sexually transmitted diseases. Abstinence or not having sex is the only way to prevent STDs 100%. Condoms may lower your risk of sexually transmitted infections if properly used 100% of the time. Exposure to multiple partners increases your risk of STDs. Let's take a closer look at each of these types of birth control. Long-term methods are the most effective with a pregnancy rate of less than 1%. Permanent sterilization is available for both men and women who have decided that their families are complete or have a condition that would make it too risky to get pregnant. For more information about these methods, please watch the permanent sterilization video in this series. Other long-acting methods are reversible, so you can later have them removed if you want to get pregnant. IUDs are inserted into your uterus in an office procedure. They can prevent pregnancy for 3 to 10 years, but can be removed sooner if you want to get pregnant. There are hormone-containing IUDs, non-hormone-containing IUDs. Both types prevent pregnancy with a pregnancy rate of 1%. The progestin hormone in some IUDs thins the lining of the uterus so women have lighter, irregular bleeding. After 6 months, some may go without bleeding. The copper-coated IUD does not contain hormones. Some women experience slightly heavier bleeding or cramping with this type of IUD. Another long-term reversible option is a hormone-containing rod placed under the skin in your upper arm. This is done in an office procedure that takes less than 1 minute. It is more than 99% effective at preventing pregnancy for up to 3 years. It can be removed sooner if you want to get pregnant. Your fertility returns within 72 hours of removal. The most common side effect is unpredictable bleeding. Some women experience frequent irregular bleeding and some have no bleeding at all. The next most effective methods require you to take some action every day, week, month, or 3 months. Their effectiveness depends on how timely and consistent you are. They are generally less invasive but still require a prescription. The combined oral contraceptive pill contains estrogen and progesterone. It is one of the most popular forms of birth control. It can also control bleeding and cramps and can prevent some forms of cancer. But you must remember to take it at the same time each day, and there is a risk of clotting for women with certain conditions and women over 35 who smoke. The same hormones are available in a patch that you change once a week, so there is less to remember than taking a daily pill. However, it costs more than the pill and has the same risks. It has some absorption variability and may be less effective in women who are overweight. Another option is a vaginal ring that you insert into the vagina and wear for 3 weeks. Then you remove it during the week you have your period. Again, there is less to remember than taking a daily pill, but it has the same risks and generally costs more than the pill. Some women may also experience a vaginal irritation. The mini pill contains only progesterone, so it is safer than combined hormone methods for smokers, women who have risk of clotting, and women who are breastfeeding. However, it is less effective and must be taken at exactly the same time of day. Missing a pill by hours increases the risk of pregnancy. There is also an injection you can get at your healthcare provider's office every 12 weeks. You can have irregular light bleeding and spotting. After 6 months, you will have less bleeding, and some women do not have periods. This is safer for women who are prone to clotting because it is progesterone only. It has a lower pregnancy rate than pills, rings, or patches, but it may take 12 to 18 months to wear off and for fertility to return. It also requires office visits every 12 weeks. Barrier methods have the highest rate of unwanted pregnancies among the methods discussed in this video. The most common causes of failure are using them incorrectly, forgetting to use them when the time comes, breakage, or permeability. Some are available over the counter and others require a prescription and a fitting with your healthcare provider. Condoms have the added benefit of reducing the risk of sexually transmitted diseases. There is a lot to consider when choosing birth control, and your needs may change during your lifetime. Talk to your healthcare provider to learn what is right for you and to fully understand the risks and benefits before you choose. Here are some important factors to consider when discussing birth control with your healthcare provider. Your overall health, how often you have sex, the number of sexual partners you have, the effectiveness of each method at preventing both pregnancy and sexually transmitted infections, your comfort level with using the method, and any potential side effects. You should also let your healthcare provider know if you think you may be pregnant or if you are breastfeeding. If you don't have a healthcare provider, we can help you find one. Call Mid-Michigan Healthline toll-free at 800-999-3199.